You are live, ma'am.
Yes. Hello, good afternoon. My name is Dr. Mounika. I'm a consultant pediatric nephrologist and a pediatrician. I take care of children's kidneys and urinary tract related issues. I'm a part of Kim's Cuddles, Secunderabad, Gachibowli, and Kondapur. So I will be talking about bedwetting. So what is bedwetting? A child is said to suffer from bedwetting if the child is more than 5 year old and has wet his or her bed more than 3 times in a week. Then we say that children are suffering from bedwetting. So is this a common problem? Yes, it is. It's a very commonly seen problem, and recent researchers have shown that 4 to 14% of school going children have this bedwetting problem. So why do only some children have this problem? It could be of multiple reasons. So basically our body produces a hormone called ADH, antidiuretic hormone, in the night time to ensure that we produce lesser amount of urine in the night time. In some children there is a deficiency, that is decreased secretion of this hormone, which leads to increased production of urine in the night time than that our bladder can hold. So that is why there is bedwetting. Some children may have a smaller bladder which can store lesser than average amount of urine, which leads to increased urination and bedwetting. There is bladder instability. That is, whenever the bladder is filled with urine, it contracts immediately, other than waiting for it to completely fill. In such cases, also we see bedwetting. There are some hereditary causes where, if the parents, like example, of one parent is affected with bedwetting problem, there is a 40% chance that the child may also be affected. If suppose both the parents have encountered the bedwetting issue in their childhood, there is a 70% chance that the children may also have bedwetting problem. So why do we need to treat this seamlessly harmless problem? The main issue we are facing is bedwetting is not a psychological disorder, but it impacts on the child's psychological development. We have seen that children who come to our OPDs have depression, a sense of loneliness, and isolation. They also experience lack of confidence. We know these children go for a sleepovers to their cousin's house, friend's house, which they're unable to do, which increases the sense of loneliness. And there is a friction. If there are siblings who are staying in the same room, there is always a friction between these siblings, and there is friction between their friends, because of which they are psychologically affected. These children tend to have low self-esteem, and they have some social adjustment problems also. And it is told that the earlier we treat this bedwetting, it is seen that it is treated and they don't pursue this bedwetting in the adulthood. And how can, as parents, prevent this bedwetting issue in the children? First of all, we have to understand that it is not a psychological disorder. It is not under his or her own will to control the urge of bedwetting at night. We have to empathize with the children, give support to them, and give them confidence. First, we have to praise the dry nights. In case the child doesn't pass, we have to emphasize on it and praise the dry nights. And coming, suppose in case the accident has happened, so we don't punish them. Punishing should be abandoned, should not punish these children. And we have to encourage them, give them courageous words, sit with them, talk to them, and give them more confidence, so that they can deal with these issues. So how about drinking water in children with bedwetting? So daytime, we encourage these children to take regular amount of water. But coming to the night time, you have to avoid caffeine, cola, and excessive drinking of water in the bedtime past 6 p.m. That is how we train the bladder, and we don't excessively trouble the bladder in producing even more amount of urine. So how do we evaluate these children? These children need to undergo of detailed evaluation, which requires a bladder diary, which requires measurement of intake of all the liquids and complete output of urine for the 48 to 72-hour period. We require a urine analysis to make sure there is no underlying infection. We require a ultrasound scan which is done by expert radiologist, which is a measurement scan where we figure out how much can the bladder actually hold the urine. What is the trigger, what is the first instance where the child is urging to pass the urine, and then we even measure post voiding, is there any residue which is left in the bladder. By this we can come to a conclusion where is the problem, as we have discussed earlier, what is causing this bedwetting. How about this? Is there any specific treatment for these issues? Yes, there is a specific treatment. First, we have to undergo a detailed evaluation to know the cause. Once we know the cause, we can start on a specific medical management, which will be discussed with the pediatric nephrologist in detail. And how long the duration of the medication is required, what are the possible outcomes of this, and when can we expect a change. This is what we'll be discussing in the treatment. Coming to and we also start the treatment with conditioning, where the child is woken up at regular intervals in the night so that he or she can pass urine and come back to the sleep. Sometimes these parents have asked me, Madam, is there any is there any abnormal deep sleeping problem in my child because of which there is a bedwetting problem? So there are not such associations noted till date. Many children, they are difficult to wake up in the night. How much ever we put the efforts, the children don't wake up in the night. This is what I frequently listen from the parents. So even in children who do not have bedwetting, or in children who have bedwetting, this deep sleep pattern is noted, and it is not associated with bedwetting. So how do we, first thing we have to always remember is encourage the child, put the child in confidence, and lay a strong foundation to start the treatment. This is how it helps us to treat the child. And second thing is the compliance. That is, once we start the treatment, the regular monitoring and seeing how the improvement is happening, so that we can alter the medication if required. That is how helps in the management. So there are many questions which arise. So should we hold the urine and do not pass the urine and try to control for our bladder capacity to increase? Such management is not advised in these children. At 2 to 3 hour interval, we have to encourage the child to regularly pass the urines. There are some associations where severe constipation is also associated with increased frequency of urine. So we have to improve our gut health. That is, first identifying that the child is suffering from constipation. In such cases, disimpaction and maintenance therapy is advised. After that, we advise timed urine and double voiding in these situations. So constipation should be treated first. The underlying cause should be always treated first. This is what we have learned about. This is what we have learned about bedwetting. So any other questions, you can please put up in the comment box. So here, yes, I have got a question. At what age is bedwetting considered a problem? So more than 5 years, any child suffering with bedwetting, you have to come for a detailed evaluation and management. Any other questions? Yes, there is medical management for bedwetting. First, we have to understand what is our underlying issue. Is this because of the hormone, as we have discussed, or is it because of a small bladder capacity? Is it a genetic? Depending on that, we have to start our treatment. There is definitely a specific treatment for each of those conditions. And is there any medical management for, is there any potential cause for bedwetting? Yes. So as I have discussed, it could be because of the hormone deficiency, which we all generally produce in the night time, that is ADH deficiency, or it can be because of a small bladder. Is it because of a bladder instability, that is irritability, where a small amount of urine is stimulating us to pass the urine, or is it genetic? Depending on the cause, we start the treatment. If the there is another question which they are asking: should we wake the child up in the night to use the bathroom? See, we are trained to hold the urine. In case we are failing to do so, we have to wake the child at the approximate time and then encourage them to pass the urine and use the washroom. The question I get here is there a link between bedwetting and my child's bladder capacity or size? Yes, that is definitely an underlying cause. The children's bladder size or a capacity first should be evaluated as per the age. If that is the cause, if the small bladder capacity is the cause, in such conditions we start with a medical management along with conditioning. Can bedwetting be hereditary? Yes, it could be hereditary, but hereditary can be of both the sides, either as a small capacity bladder or a ADH deficiency. We have to diagnose the cause and then start on the treatment. What are the treatment options for bedwetting? As I have told you, depending on the cause, we start the medical management. So many a times the conditioning also helps. Avoiding fluids past 6 p.m. also helps. Along with that, some cases require medical management. Yes. The treatment which we are starting should be decided based on the child's cause. So if the child, what is the underlying pathology which is causing the bedwetting, that is what we are going to treat. So that first should be evaluated. Yes. Yes, should we, the question I get here is, should we restrict the child's fluid intake before bedtime? Past 6 p.m., it is advised not to take excess amount of fluids. Caffeine and cola should be definitely avoided in these children. How the question here is, how can we help the children stay dry during sleepovers or trips? First, we should start on the medical management, which will help these children to stay dry during the sleepovers or trips. First, encourage the child. Do not punish the children. Do not tell them words which can hurt their psychological balance. And you have to encourage them. First, we have to come to a diagnosis. Early treatment can help us in long term. So earlier you come meet the doctor and diagnose what is the underlying cause, we can help the children in many ways. Is it okay for the child to keep using diapers in the night? So it depends on the age group of the child. So diapers can be used in the night, it is not contraindicated, but how long are we going to use the diapers? If the child is more than 5 years, we have to wake the child, encourage them to use the bathroom. If not, we have to understand that is there a real bedwetting problem which is there, and then we have to start on the treatment. Is there a link between bedwetting and constipation? Yes, there is a link. Severely constipated children tend to have a bladder irritability, that is increased frequency in the daytime, in the night time, and these children can have bedwetting. So one thing I want to tell is there are some other associated symptoms which can be seen. Some daytime symptoms like daytime urge incontinence, that is they cannot hold the urine for a long time during the day, and unaware of their any urinary leaks. These symptoms may also be persistent with bedwetting. We have to have a keen eye for such symptoms. Is there bedwetting on and off is the question I'm getting here. There are temporarily there can be a bladder irritability issue in few children which should be treated, but as I've told, what is causing this temporary start of bedwetting? What are the symptoms? What are the underlying problems? We have to do the is there any infection, is there any urinary tract infection which is present, which is causing such symptoms, and is it going to be temporary, or is it, or do we require a long term medication? Will be requiring upon the cause of the problem. I'm having a question here. A 6-year-old female child came with bedwetting. Her urine routine microscopic culture is not significant. Ultrasound abdomen is normal. She is not having any other symptom. So what can be the treatment? So the child with a bedwetting in a 6-year-old, is it only the night symptoms or also a day symptoms? Daytime, what I have told, daytime urgency, urge incontinence, or they are unaware of their leaks, urinary leaks. Are they also present? The daytime symptoms are also present. Suppose only the night symptoms are present, how many times in the night? Is there 1 to 2 times per night or more than 2 times per night? And after this, we do a detailed evaluation with a bladder diary for 48 to 72 hours. After that, we do a urine analysis and a measurement ultrasound scan, by which we can come to a conclusion what is the underlying cause, whether it is the ADH deficiency or a small capacity bladder, after which we can start on the treatment, specific treatment. Urinary incontinence. Depending on the child's age, more than 6 years, we teach the children Kegels exercises where our pelvic floor muscles are tightened. These exercises should be encouraged in children, especially with urinary incontinence. That helps. Along with that, if we are seeing the severe constipation, that should be primarily treated with disimpaction and management treatment, where it is sometimes given for a longer time. Sometimes 1 to 2 days of management will help us. So constipation, high fiber diet, regular toilet training is encouraged in these children. So they're asking me if there is pus cells, if it is present in a urinary analysis, how much and how is it significant? So pus cells more than 5 on a urine analysis in a midstream sample. That is, if you are collecting the sample after leaving few drops in the stream, then more than 5 are significant. My child wets the bed, but not every night. Is it normal? So I would like to know what is the age of the child, and more than 3 times in a week is only diagnosed as bedwetting. Other than that, it is normal. Sometimes some leaks tend to happen even in little older children. That can be acceptable. Okay, only night symptoms. Can you please daytime symptoms? So here they have a question. There is a child with nighttime symptoms more than twice per night. This is what I was talking about. So sometimes not that child passes only once. The child passes only once. Sometimes these children can pass 2 to 3 times per night. So only with the history we cannot come to a conclusion. We need a detailed evaluation where the bladder diary plays a very significant role. A detailed history along with the examination and bladder diary and an ultrasound scanning is a mandatory in these children. Are they specialists who are focused on bedwetting? Yes, pediatric nephrologists are the doctors who treat these bedwetting problems in children. There is a 5 to 6-year-old female child with recurrent UTI thrice a month. Should we consult or any specific treatment? Yes, the more than 2 urine infections in a year is considered as abnormal. We have to make sure what is the underlying cause. From your end till you meet us, you can do is prevent constipation, increase high fiber diet, make sure make sure the child is toilet trained. Timely voiding is advised. Is there any significant volume of urine to label it as bedwetting, ma'am? No, we cannot measure the volume. Even small leaks once in a while is acceptable, but more than 3 times in a week, even though there is a small capacity, even though there are large volume of urine, it means that it is abnormal. These children, conditioning helps. Suppose you feel that child is having very small amount of leak once or twice in a week. These children should be woken up in the night. Conditioning is much required in these children and should be advised to use the bathrooms. MCUT is started at what age? How frequently do we do the test for recurrent UTI? First thing which we have to make sure, and I want to educate the parents, is MCUG is advised in cases of recurrent UTI, but should not be performed during active infections. First, we have to make sure that urine infection is treated, after which we give a period of 2 weeks, after which is where we advise an MCUG in children. It can be done in children as less as 1 month old. So what is the age limit where we should consider for treatment in for bedwetting? So children who are more than 5-year-old with more than 3 times per night, you have to consider treatment for bedwetting. Earlier you start the treatment in these children, the better is the response, and these children will be prevented in having a long-term effects, that is adulthood bedwettings also. Do we require to give any other medical management? Yes, medical management is mandatory in these children, but first we have to know what is the underlying condition which is causing this bedwetting. Medical management should be started under the guidance of a pediatrician or a pediatric nephrologist, who will advise you the duration of the treatment and how do we monitor the improvement in the treatment. That is where the doctor plays an important role. So medical management can be started in children who are older than 5-year-old and still passing urine more than 3 times per night. Do we require to measure bladder capacity separately at day and night? So it's a very good question. So we do a specific measurement scan where we usually do the bladder capacity during the daytimes. During nights, the bladder diary will give us the volume. So where we are example, say we know the child passes every day urine around 2 to 3 a.m. So we wake up the child around 2 o'clock, encourage them to use the washroom. You can measure the volume. That will give us the bladder capacity during the night, or how much we have drained in that time, and we can come to a conclusion whether there is any ADH deficiency or the urine concentrating ability deficiency in the night. Any side effects of the medical management? So first of all, we should know which medicine are we starting on. They are very safe, they are good safe medications, they are not much they are all acceptable side effects. First I want to say is there is no treatment without any side effect. Even to a minimal paracetamol, there are minimal side effects which are seen, but these medicines are having a safety profile where the side effect profile is seen in very less people. What is the duration of medical management? So depending on the underlying cause, if there is a small capacity bladder and the age of presentation, if the child is presenting at an earlier age, the requirement of duration of this treatment will be for a lesser time. If you're bringing the child around 10-year, 11-year, then the duration may extend up to 2 years. I hope this talk has been very informative and has cleared most of the doubts. So I would say any children more than 5 years and wetting the bed more than 3 times per night, please come for medical advice. That will help the child in a psychological way and has better confidence and overcome all the psychological adjustment issue. Thank you.